Hello everyone and welcome to Blood and Hematology YouTube channel. This video is about erythrocyte inclusions and distribution. Howell-Jolly bodies are round, cytoplasmic red cell inclusions that have the same staining characteristics as a nucleus. Howell-Jolly body is a fragment of nuclear material. It can arise by karyorrhexis or by incomplete nuclear expulsion, or can represent a chromosome that has separated from the mitotic spindle during abnormal mitosis. They can be a normal finding in neonates, in whom the spleen is functionally immature. They are a relatively frequent and not very specific erythroid abnormality, seen particularly following splenectomy, hypersplenism, dyserythropoiesis and accelerated erythropoiesis. Howell-Jolly bodies and other red cell inclusions should be distinguished from artifacts, cell debris, stain precipitates and platelets superimposed on erythrocytes. The figure demonstrates a platelet superimposed on an erythrocyte containing a Howell-Jolly body. Basophilic stippling describes the presence of considerable numbers of small basophilic inclusions that are dispersed through the erythrocyte cytoplasm. They are composed of aggregates of ribosomes and degenerating mitochondria. Siderosomes also may be included in the aggregates, but most such inclusions are negative with Pearl's acid ferrocyanide stain for iron. Basophilic stippling is a quite common finding and does not have any specific diagnostic significance. The most obvious basophilic stippling is seen in lead poisoning, in which the granules are particularly large. Basophilic stippling also is a prominent feature of hereditary deficiency of pyrimidine 5' nucleotidase, an enzyme that is required for RNA degradation. Pappenheimer bodies are basophilic inclusions that may be present in small numbers within the hemoglobinized portion of erythrocytes. They often occur in small clusters towards the periphery of the cell. They are composed of ferritin aggregates, or mitochondria or phagosomes containing aggregated ferritin. Pappenheimer bodies are seen particularly in congenital sideroblastic anemia, splenectomy, myelodysplasia with significant dyserythropoiesis, hemolytic anemia, and iron overload. Siderotic granules are iron-containing cytoplasmic inclusions. On a Pearl's Prussian blue stain, they appear as multiple dark blue irregular granules. On a Romanowski stained blood smear, they are designated as Pappenheimer bodies. The erythrocyte containing siderotic granules is known as siderocyte. Siderocytes are rarely detected in the blood of normal subjects. Siderotic granules are present in reticulocytes newly released from the bone marrow, but disappear during maturation of the reticulocyte in the spleen. Cabot rings are purple-blue structures that appear as rings, loops, or figure 8 in red blood cell cytoplasm. They are remnants of mitotic spindle fibers. They are seen in megaloblastic anemia, acute hemolytic anemia, the extramedullary hemopoiesis of primary myelofibrosis, myelodysplasia with marked dyserythropoiesis, and after splenectomy. In beta thalassemia intermedia and major, because of the imbalance between the rate of synthesis of alpha and beta globin chains, alpha chains precipitate within erythroblasts in the bone marrow. Sometimes alpha chain precipitates are also apparent in the peripheral blood in both erythroblasts and erythrocytes. They are particularly likely to be seen in erythrocytes if the pitting function of the spleen has been lost as a result of splenectomy. Polychromatic erythrocyte appears as reticulocyte on supravital staining. The supravital stain allows cells to be recognized by the blue intracytoplasmic precipitate, ranging from the appearance of granules to a network of reticular material. Heinz bodies are intraerythrocytic small and round inclusions, composed of denatured hemoglobin, visible by supravital staining. They are irregular in shape and are located mainly in contact with the inner surface of the red cell membrane. Heinz bodies are not seen in normal subjects since they are removed by the splenic macrophages in a process known as pitting. They form in red cells when there is an unstable hemoglobin, thalassemia syndromes, G6PD deficiency, oxidizing chemical exposure, and following splenectomy. Hemoglobin H inclusions are formed by precipitation of hemoglobin beta chain tetramers. With supravital staining, they are seen as rounded bluish inclusions, distributed regularly through the cell in relatively high numbers. Agglutinates are masses of red cells, varying in size and shape and with an irregular outline. They can contain few or numerous cells, and there is an apparent loss of the distinction between one cell and another. Red cell agglutinates generally result from the presence of a cold agglutinin, usually IgM. They are often seen in mycoplasma infection, influenza, and other viral infections, lymphoproliferative and plasma cell disorders, cold hemagglutinin disease, and paroxysmal cold hemoglobinuria. They are rare in warm autoimmune hemolytic anemia. In rouleau formation, erythrocytes are arranged in rows, like stacks of coins. By convention, a rouleau is composed of at least 4 cells in linear array. In smaller rouleaux, the area of central pallor is still apparent and, in comparison with agglutinates, the outlines of single cells are still visible. Rouleau formation must be assessed in a thin part of the film where the distribution of erythrocytes should be uniform. Rouleau formation occurs with samples from patients with hyperproteinemia or dysproteinemia of various types, multiple myeloma, monoclonal gammopathy, infections, and chronic inflammatory and neoplastic disorders. Resetting of red cells around neutrophils is a rare phenomenon that is likely to be antibody-mediated. It is sometimes an in vitro phenomenon and may be EDTA dependent. Red cell resetting has been observed, together with erythrophagocytosis, in paroxysmal cold hemoglobinuria. Thank you for watching this video. If you liked this video, to give it a thumbs up and share it. Do not forget to subscribe to the channel, if you still have not. You can click on the bell to receive notifications whenever a new video is uploaded.